The broadcast is now starting. All attendees are in listen-only mode.
Welcome to today's webinar, hosted by the Global Institute for Simulation Training and Education Management Solutions. Today, our topic is promoting interprofessional communication and teamwork using virtual simulation and deliberate practice. And that is brought to us today by Dr. Megan Kaiser and Dr. Carmen Turkelson. Thank you for joining us. My name is Lori Kearns. I'll be your host today. Also assisting from EMS is Chris Qualtieri and Gwen Willie. Now, as a reminder, you can close that control panel on the right side of your screen by clicking the orange button and use that chat panel to post your questions and communicate with us. And as a practice, enter your first name and where you are joining us from now. We are in listen-only status due to the large number of attendees today, and for technical support, we have listed the GoToWebinar support number here. Yes, we are recording the webinar. You will receive a link to the recording and the slides from our office within the next few days, and we very much appreciate your feedback. Please take a moment to let us know your thoughts. Now, please allow me to introduce you to today's guest experts. Dr. Megan Kaiser is a Director of Undergraduate Nursing Affairs and an Assistant Professor of Nursing in the School of Nursing at the University of Michigan Flint. She received her Doctor of Nursing Practice degree from Wayne State and is board certified as a Certified Neuroscience Registered Nurse, a Stroke Certified Registered Nurse, a Certified Healthcare Simulation Educator, and an Advanced Clinical Nurse Specialist. She has been practicing as a neurosurgery nurse practitioner for over 25 years and joined the faculty in the School of Nursing at the University of Michigan Flint in 2013. She is conducting research on the effective use of simulation in the educational preparation of acute care nurse practitioners, as well as the use of simulation to strengthen the interdisciplinary healthcare team. Also with us today is Dr. Turkelson. Dr. Turkelson is the Associate Director for the Nursing Simulation Center and is an Assistant Professor of Nursing in the School of Nursing at University of Michigan Flint. She has been a nurse for over 25 years and has extensive experience in critical care management and education. Her experiences have included both low and high fidelity simulations, in situ experiences, large-scale community-based disaster simulations, virtual and standardized patient simulations. Dr. Turkelson has also had the distinctive honor of participating in the 2011 National League for Nursing Leadership Development Program for Simulation Educators and was one of the first certified healthcare simulation educators from the Society of Simulation in Healthcare. The primary focus of Dr. Turkelson's scholarship is simulation-based educational research examining aspects of learning, interprofessional teamwork and communication, and patient safety. Dr. Turkelson and her colleagues have been the recipients of several internal research grants, as well as were recipients of the Anaxel, Chamberlain College, and DeVry grant in 2017, providing continued support and expansion of their work related to the simulation and simulation-enhanced interprofessional education. Wow, such distinguished guests today. Please welcome Dr. Turkelson and Dr. Kaiser. And I have already seen so many folks have joined us. We've got Jameson and Catherine and Francis and Maria, and we just want to say thank you for joining us today. And Dr. Turkelson, I am sending the controls over to you.
Thank you very much, Lori. We are really excited about this opportunity to share with everyone our experiences in developing interprofessional simulation-based education, specifically those focusing on use of virtual simulation and deliberate practice. I'm going to skip our slide on introduction since Lori just did a beautiful job providing an introduction for both Dr. Kaiser and I. And I do want to mention that neither Dr. Kaiser nor myself have any conflicts of interest to report to you today. I also want to start out by sharing that it really takes a village. And so today it's just Dr. Kaiser and I presenting, but to have this project take place literally took multiple people, and we'd like to recognize some of the people that are not with us today, including our colleagues, Dr. York and Dr. Smith from the College of Health Sciences and Physical Therapy program, They are our other team members, and we've called ourselves Team Calm, and it spells out our initials, so of our first name. And really, without the two of them, our project would not have taken place. We also want to acknowledge Ron Streetman and James McTieran. They are our two simulation operational specialists, and again, without them, none of these projects would take place. And then we do want to also acknowledge Inaxel, as well as Chamberlain College of Nursing and DeVry Medical Center. We applied for a grant, and we were grant funded for the project that we will be talking about today. So we want to acknowledge them as well. And then finally, as you can see on the screen, most importantly, we want to acknowledge all the students who have taken part in our simulation enhanced interprofessional education activities. So the objectives today will be for us to describe to you how a virtual simulation enhanced interprofessional education, or Sim-IPE deliberate practice experience, was developed for undergraduate nursing, graduate acute care nurse practitioner, and doctoral physical therapy students, with a goal of enhancing communication and teamwork between the disciplines. We will also be discussing how utilization of either a virtual or face-to-face Sim-IPE deliberate practice opportunity is really essential to help enhance interprofessional practice in any setting to improve team performance and patient outcomes. So we'd like to find out a little bit more about our audience. So the first question we have for everyone is, have you developed any interprofessional simulation activities for your learners?
And that poll is open and the results are coming in now. And I'll give our audience members just a few more seconds to respond. And do you want to guess about our audience, about how many are saying yes and how many are saying no?
I would guess a majority have.
And you would be correct. So let me share that information. So of our audience members, a full 70% are saying yes, they have developed interprofessional simulation activities, and leaving 30% at no.
Okay, excellent. This is what we would expect. Our next question is, have you developed, oh, I'm sorry, I need to advance the slide. Have you ever incorporated distance students into simulation activities?
And that poll is open as well. And those results are coming in, and they are almost just the opposite. So I'll give just a few more seconds without cueing anyone. Okay, it looks like those results are in. So a full 80% of our audience today are saying no, they've not incorporated distance students into simulation activities.
So that's interesting, and also where utilization of a virtual platform or other technology can really help you bring in those distance learners, which our acute care nurse practitioners are not face-to-face learners. So we'll talk about that. Our next question is, have you used any of the following technologies to incorporate students into your simulation activities? So learning management system, a robot, so we have an iBot, or virtual platforms.
And that poll is open and the results are coming in as well. I'll give our audience just a few more seconds to register. And all right, it looks like we can share those results now. And it looks like a full 65% are saying a learning management system, 10% using a robot, and 25% using a virtual platform.
Okay. All right, excellent.
Back to your slides now.
Okay, so as we start the presentation, I'm going to just really kind of quickly go through some of the background for why we developed our simulation enhanced interprofessional education activities. And I believe that everyone is aware that the recommendation to improve interprofessional teamwork within the context of a collaborative patient-centered care environment, that's pretty clear. We all know that there are widespread errors in United States hospitals, and those errors are associated with preventable morbidity and mortality. And it reflects a lack of quality across the healthcare system. The one thing that really isn't clear, though, is what is the best way to facilitate the development of these interprofessional skills, such as teamwork, communication, and collaboration. And so as a result, across the country, we really have a wide variation in how we're preparing our future interprofessional healthcare workers. In fact, many institutions have now initiated IPE into their courses, but maybe it doesn't include all the professions that they're going to be interacting with, or there are still groups that are trained in silos. So we are still kind of learning what is the best way to do this. And when we don't train as interprofessional teams, our future healthcare workers are going to lack those critical but non-technical knowledge, skills, and attitudes that are really essential for effective teamwork. This slide is just highlighting for you the interprofessional collaborative competency domains that have been established by the Interprofessional Education Collaboration. And there are 4 main competencies that are necessary for interprofessional practice. And they include values and ethics, roles and responsibilities, interprofessional communication, and interprofessional teamwork and team-based practice. Our project focused only on 2 of these competencies, interprofessional communication and interprofessional teamwork. And this slide is just highlighting that again further. We again focused on the last 2, 3 and 4. We do highlight some of the roles and responsibilities between the professions in some of our deliberate practice activities. We do like icebreakers where each of the professions learn about each other and like what physical therapy does versus what nursing does. And we have some IPE modules that are offered through the University of Michigan available to all the students that really cover values and ethics and roles and responsibilities. So again, we focused on the last 2. So a little bit about our personal journey. This project included the School of Nursing as well as the College of Health Sciences and the Department of Physical Therapy. And we really developed a partnership between the College of Health Sciences and the School of Nursing to create all of the IPE activities that we have done so far. And our journey really started organically, I would say. We initially, the group of us, Dr. York, Dr. Kaiser, Dr. Smith, and myself, applied for a grant in June of 2015. And since that time, our first IPE simulation enhanced experience was implemented in January of 2016. And we have expanded now to include a neuro IPE experience, cardiac, community, discharge planning, end of life, house of horrors. So it's just grown significantly since that time. Our team has also been very fortunate, and we've received multiple grants to help support and expand our IPE efforts. And our entire team, including our SIM operational specialists, are all now master trained in team steps too. And 3 out of 4 of the faculty have also completed an IPE fellowship through the University of Michigan. So we've been super fortunate to have great support from our administrative teams at the College of Health Sciences and the School of Nursing to help us expand our journey. Since our first implementation, we've actually had over 2,000 students now participating in IPE experiences. And the purpose of today's presentation, though, is to talk about just one of those experiences. And what we realized over the course when we first initiated our IPE activities, we found that the students, they would come for a simulation-based interprofessional activity, and we found that they struggled with some of the communication tools that we were teaching them. We felt like they needed much more time to practice and get feedback and really develop those communication tools. So the purpose of the project that what ended up being grant funded was to explore the effectiveness of using a virtual simulation IPE deliberate practice experience on interprofessional team communication, performance, and mannequin patient outcomes with the undergraduate nursing, graduate nursing, and doctoral physical therapy students. What we found is, like I said, they really needed an opportunity to practice more and get feedback. And we compared virtual versus face-to-face deliberate practice in the project that was grant funded. Our vision was to create a realistic but sustainable, and this is really was key for us. So we knew the grant funding wasn't going to last forever. So we wanted what we were creating to be something that could be sustained and carried on even after the grant was no longer in place. I mean, we're still seeking funding, but as we always are, but we knew we might not have grant funding forever. And then again, we really wanted to create opportunities for students to deliberately practice and really embed those communication and teamwork strategies before they participated in a larger simulation IPE event. When we were creating these opportunities, really all of our IPE simulations have been developed using the ANACSL standards of best practice, Sim-IPE, so we followed those standards very closely as we developed all of these activities. Our theoretical model followed Erickson's deliberate practice, which really, again, was to provide multiple opportunities for students to practice and receive feedback on their team communication. And again, we wanted to really explore, would there be a difference if we used the virtual platform or a face-to-face method for these deliberate practice activities? The evaluation metrics we focused on, we used Kirkpatrick's model, and we are, and Dr. Kaiser will be talking about this shortly, our evaluation metrics, we really tried to focus on the higher level. So we know students like these activities, so we wanted to move past just their attitudes and perceptions and really look at, was there a change in their behavior or their performance as a team, whether they had face-to-face or virtual deliberate practice. Our challenge, similar to everybody else, since a majority of people on the call today have experience with simulation and IPE. I know you know the challenges of scheduling, time, resources, faculty, all of that. Our other challenges, though, were creating or developing a realistic simulation scenario that would work across multiple learners at different levels. So we had undergraduate and graduate level students that are scenarios both for the deliberate practice and for the main simulation had to work for. And because we'd already had IPE sims created, the other challenge was now creating simulations or experiences for the deliberate practice sessions that will still meet the objectives of our overall Sim-IPE activities. So it goes without saying, all of these activities require a lot of planning. So of course, you're going to start with identification of your program goals and objectives, identify your evaluation metrics, your pre-briefing and debriefing methods, and then establishing a timeline. We also created pre-simulation learning content, and all of our pre-simulation learning content is placed on Blackboard. So we had an online module that introduced the communication strategies and some basic IPE and teamwork strategies to the learners before they came to any deliberate practice session and before they came to any main IPE simulation session. And the main thing we focused on with this project was utilizing an innovative virtual platform, and we used the EMS Simulation IQ IPE platform, as well as a face-to-face format. So we really had to develop now simulations for the students to use during the deliberate practice sessions. They were similar to those simulations that they would experience face-to-face when they came to our Sim Center to do the bigger simulation session, but they were not exactly the same. Again, the idea was for them to practice those communication tools, develop confidence and get feedback, and then when they came to their main simulation session, they would perform better, was our hope. There were two main phases for this project. In phase one, in the winter semester of 2017, we randomly assigned half of the students to 2.5 hours of deliberate practice, either a face-to-face format, which meant they came to campus, or they were on the virtual platform. So they would attend their deliberate practice session, and then 2 weeks later, they came here to campus to participate in a multi-patient IPE simulation. We repeated this again in the fall, And we had a booster session for some of the students in June, and that was voluntary, so there wasn't very many students that actually did that. But then in the fall, we repeated the 2.5 hours of deliberate practice, again, either face-to-face or virtual. And we had some new students at that time that were assigned randomly to either of those sessions. And again, that was followed by a main IPE session. This is just really highlighting our innovative approach. Even before number 1, I probably should have put on there that we had all students required to do that pre-learning about the IPE communication tools. They then came to the deliberate practice session, and I say came to, they either came to it virtually or they did it face-to-face, and then they followed that with a large-scale simulation-based learning experience. It was interprofessional, and we also had mentoring because we had students from all different levels of the program involved in this. So we had our second semester and third semester nursing students, first and second year physical therapy students, and then we had our acute care nurse practitioners. And they were partnered up in a way that the younger students were with the higher students so that they had somebody in their profession that was a little more experienced than them. This slide is just highlighting for you, like I mentioned a minute ago, we used Blackboard, and so we created a simulation Blackboard site for all of the students to go as a landing spot for the objectives for their deliberate practice session, the objectives for their main IPE session, and any pre-learning content. And you can just kind of see some of that on the bottom right-hand slide there. We did utilize evidence-based communication and teamwork tools from Team Steps. We also utilized crew resource management strategies, the effective followership algorithm, or the 3 W's, what I see, what I'm concerned about, and what I want. Those were the main tools that we focused on teaching the students during this project. This slide is just highlighting for you the importance of ensuring that there was pre-learning and briefing information for the students. So we built this in not only for the face-to-face learners, but also for the virtual learners. And one thing we learned between the winter and the fall is that we needed to do a kind of separate pre-briefing and additional pre-learning and briefing on just the virtual platform for those learners, because it was a little bit different for them rather than being face-to-face where there was a faculty member always present to answer questions. So I want to dive in a little bit with the deliberate practice sessions. We did develop 4 patient vignettes. We created a mock patient scenario, and they were, again, similar to those that they would experience in their main simulation IPE, but not exactly the same. And we wanted to have multiple cases so that students could have a different case each semester. So they weren't seeing the same case. If they, if they were first year and second year, they would be repeating it. The first years would be repeating the simulation in the following semester. So we didn't want them to have the same types of scenarios. So we usually do like neural focused in the winter and cardiac focused in the fall. And then we also, again, give them the objectives based on that. The other thing we did was develop faculty role modeling. So we created faculty exemplars where we role modeled the behaviors that we were looking for. So we did what we considered to be a very good briefing or a very good SBAR handoff for the students. And these were embedded into the virtual platform as well as used during the face-to-face sessions. And again, all students before they came to the deliberate practice had the pre-learning modules that introduced these tools that we were then utilizing in the face-to-face or virtual deliberate practice sessions. This slide is just showing you 2 of the cases that we created, and it's a screenshot of the virtual platform. So we fully developed the background, the history, the reason the patient was there in the hospital. And again, it was a similar type scenario to what they would see later on. How we did it differently, though, is, and here's just another slide, I'm going to go back, sorry. We just flushed it out, but then we added under the resources section step-by-step guides of what we wanted the students to do as they worked through the case. And then that's where we also included our faculty exemplars. So this is just kind of a bigger version of Joe Jackson, and he had a traumatic brain injury. This slide is showing you one of the things that we had to do was create all of the teams. So again, all the students were either randomly assigned to face-to-face or a virtual practice session. So in EMS, we then had to get the students enrolled, and then we had to create the teams. And I think at the end, I don't know, I mean, because we did multiple teams, so we have like probably over 80 teams. And I'm going to bypass this slide and just move to the reference slide. This is, again, so we didn't have our students in EMS, we didn't have them actually doing blood pressures or assessments in the platform or making orders for the patient. We had them read through the patient case and the scenario, why the patient was there. And then under the reference materials, you can see, again, we uploaded multiple videos. So we gave them instructions, watch the first video, and then as a team, discuss and identify where the team members could have utilized the teamwork tools. And then after that, there were other videos they needed to watch in order, and they would be examples of us communicating, and then the students would need to practice that communication tool 4 times. At the very end, all the students had to upload their best version of one of the communication tools. We followed the same format that you're seeing on the slide for the students that were in the face-to-face session too. So they all saw the same things and all had the same case scenario. For sake of time, I'm not going to play the videos, but we did embed a couple of videos. We did a Sims Gone Wild, which was us behaving badly. And again, the students loved that because they had to identify all the things that we did wrong. And then again, we gave examples of how to do the different communication tools. And then this last video would have been an example of a student's SBAR report. So all students face-to-face and virtual had to do a video exemplar of their best version. And now I'm going to hand it over to Dr. Kaiser to tell you a little bit about the scenario development and the results from our project.
Okay, so anytime you're embedding scenarios into a simulation, you need to make sure that the scenarios are developed with the use of collaboration, making sure that any and all disciplines that are going to be involved in the actual simulation are represented on the scenario development team. As Dr. Trickelson said, we had a wonderful team. We worked really well together. I'm all neuro. I don't like the heart. Dr. Trickelson is all the heart. She doesn't like the brain. So it's a match made in heaven. And we had physical therapy folks that also are certified in one in neuro and then one in cardiac. So we really could represent not only our discipline, but also our clinical specialty area. So we knew that in this simulation scenario, we wanted to embed opportunities for every single learner to be able to participate. We tested our first scenario and it flopped. It was not good. Everybody was still in their silo. We knew that we had to regroup it, redo it, which we did before the big research project. But we made sure that everybody was equally represented and that, again, every learner had an opportunity not only to focus on their discipline, but also to work collaboratively with the other disciplines. So when we did the Sim-IPEs, we brought students together in teams. Dr. Trickelson alluded to the fact that these teams were not small. We had 2 undergraduate nursing students. One served as a mentor to the other because they were a year ahead. We had 2 physical therapy students. One, again, was a year ahead of the other and could serve as a mentor. And then we had our nurse practitioner students. Now, it's important to note now that our nurse practitioner students were not available to practice, to do the deliberate practice activities. What we did was we embedded deliberate practice opportunities for them within the Sim-IPE experience because they were there and there were only 6 of them. And as you can see, we had a lot more physical therapy students and nursing students. And so their deliberate practice was actually, they repeated the simulation IP experience repeatedly over and over again on the same day so that they could have an opportunity to learn and grow with the results of deliberate practice. We'll talk about the sort of the research methodology snafus we ran into by using that procedure. So we also used an interprofessional debriefing. So when we debriefed, there was 1 nursing faculty and 1 physical therapy faculty in each room, so that we were really making sure to kind of check with each other that we were debriefing all disciplines and that they were really acting together. We used plus delta. It was nice. We went around the room at first, asked them what went right. Then we sort of asked them a little bit of what they thought they might have done differently if they had it to do over again, which was really fascinating using the acute care nurse practitioner students because they were going to have the opportunity to do it over again. And so reflecting on what they said and then what they did the next time was very powerful when we were analyzing our debriefing. So we made sure that we were facilitating the students and that every student was able to participate in the debriefing. We used a series of structured questions. The students knew ahead of time what the objectives were for the simulation. We also took pictures, and we used our pictures as data. So on the right side of the screen, you're going to see our whiteboard. So we have what were their initial thoughts about it, the plus, which what did they think went well. And we never say what went poorly. We always say, what would you change if you had it to do again? Because we don't want them really reflecting. Everybody always wants to jump on the bad stuff, I think, when we use the plus delta format. And so really trying to focus them on the good things that they did and then what they might be able to change was very key in our debriefing strategy so that everybody really left there with a takeaway and with a positive. We made them take a picture when we were done with them, and I jokingly tell them that it was to prove that nobody was injured in the performance of the simulation, but also to show that they really all got along well and they're all smiling at the end of it, so it wasn't scary. So we have a lot of data. We have a mountain of data, a mountain of videos. We use our videos as data and we use our whiteboards as data. So not only did we did the usual stuff where we looked at student satisfaction, but we also looked at how many teams did we have and how are we going to analyze these videos. So initially in the deliberate practice, we had 17 virtual and 15 face-to-face IPE teams. Again, the nurse practitioner students did not participate in this. They each did 2.5 hours of deliberate practice. Then we had 26 virtual and 20 face-to-face teams participate in the fall semester of 2017. So we have a ton of students that have been through this. We followed up with some multi-patient simulations. So we had 32 Sim-IPE sessions in the winter semester of 2017, 56 in the fall of 17. So between the deliberate practice and the IPE multi-patient simulations, we had a ton of information. We also did a little booster simulation in June of 17. We asked for volunteers, and they came in and participated in an end-of-life Sim-IPE experience. So they wasn't required, but they were more than willing to do it. So again, we looked at the usual stuff, student satisfaction. We really wanted to know was what we were doing considered valuable to the students. So even though that wasn't where we were resting in Kirkpatrick, we still wanted that information. Then we also used student reflections, and looking at the literature on use of reflection, student reflections, written reflections as data was fascinating to us. Not only how it's being used, but what is the strength of that data if you are going to choose to use it. And lastly, we use the Indiana University Simulation Integration Rubric. You're going to see IUSIR throughout the results section. So we used it to evaluate our teams during the video review. And we had video coding software, so we were actually able to code the videos with the software and use the Indiana Sim rubric as sort of a way to facilitate that. As you can look on the bottom after that bold line, that's the team behaviors, and on the top is individual behaviors. So we can actually use it and score the individuals as well as the teams. So this is some of our data. I don't want to spend a lot of time on this. Psychometricians would, I'm sure, give us an earful about, who was present, who wasn't present. I think the really important part here is that while in the student satisfaction with virtual versus face-to-face deliberate practice sessions, that while the virtual came up a little bit less than the face-to-face, if you added the extremely valuable and the moderately valuable sections together, it's pretty equal. And they're simply, especially when you're dealing with distance. Now, going back to the question that we asked at the beginning, how many of you have integrated distance learners into your simulation activities? If you have distance learners and you need to do deliberate practice, a virtual platform is your option. There isn't another one. There are many different virtual platforms you can use, or you can create your own. We used the EMS platform, and it worked really, really well for what we were trying to obtain. So I think that this data is really telling us that the virtual platform is an acceptable alternative, even though students especially nursing students, like to touch and feel and be together. So this one is the student satisfaction and self-confidence, again, with virtual or face-to-face deliberate practice sessions. This was targeting two very specific questions, again, with the navy blue representing virtual and the yellow representing face-to-face. And again, when you add all the agrees together, you really come out pretty close when you compare the virtual to the face-to-face. Again, our students, they like to be together. They're cohorted, so they consider each other family. So we know that that's sort of a little bit of an inhibitor to us because they want to be together. But we also recognize that in this era of distance education that we do need to find acceptable alternatives when we can't bring our students together. And again, we also used our student comments. So we had comments in the form of a written reflection. Every student from each discipline and every level was asked to answer the same questions, which becomes really important when you're trying to interpret this level of qualitative data. So the experience was awesome. The face-to-face interprofessional deliberate practice was extremely helpful. They felt that it should be a practice session that students can do in order to learn how to navigate through the system. So the really big dissatisfier, if you look at that third bullet, was that there were some technology glitches for those in the virtual environment. And I honestly think that that's one of the main reasons, and I'm sure when we tease our data out a little bit more, we're going to find this to be true, that was the main dissatisfier for maybe the reason that the virtual teams rated it a little bit lower than the face-to-face teams, because they did have to deal with the computer glitches, and it was a little bit of a challenge. So we have our physical therapy students who are telling us that the experience gave them the chance to experiment with different ways of communicating, that they could run through practice, and they did get to practice multiple times with people within and outside of their discipline. We gave them the videos ahead of time. They really liked that. If you look at the third bullet down, again, it's that tech stuff. Unfortunately, we were unable to communicate with the nurses via the video group chat, so they had to use, their own partners, sort of role-playing in the different disciplines instead of being able to connect with the discipline itself. Again, the technology issues, I think, really were one of the main factors that we had, and it wasn't that the platform wasn't behaving itself, it was the bandwidth in the building where we were holding the sessions was not good, because some of the students, as Dr. Turkelson alluded to, even if they were virtual, they decided to come into campus for help with the technology, and they brought their laptops. So they were still doing it virtually. They weren't in a room with their colleagues, but the bandwidth, the internet speed, all of that stuff sort of unfortunately caused them to have some angst. Nursing, pretty much the same thing. They did like it because they actually got to meet people from the other disciplines before they had to go into the simulation center and do their interprofessional experience. They thought that the deliberate practice was very useful, but this particular person in the second bullet was virtual. All of these were actually virtual deliberate practice, and she's talking about the learning curve to the virtual platform. And so that was sort of a lesson learned for us, that we really need to have opportunities for them to sort of get to know the technology before we have them doing the virtual deliberate practice. So, and this one's pretty busy, but basically what it's showing you is, if you look at the first one, which you probably can't even read, and I can barely read, total number of full debriefings. So this was when we were going through the videos, we're coding these videos, and we're looking to see how many did a full briefing. What was their score? 7 was the high score, and then if you break it down into the full briefing virtual, full briefing face-to-face, or if they ended up in a mixed team where some of the students in their team were from the virtual and some were from the face-to-face, I should note at this time that they were not kept in intact teams when they were sent to the interprofessional simulation, the face-to-face on-campus simulation experience. In the deliberate practice, they were either in the virtual or the face-to-face, and they could have been matched up with people who had done either of those things. That was a little bit of another issue in our methodology that we sort of tweaked the next time we ran this. So then we had partial briefings. So we did have teams that did a partial briefing. We wouldn't consider it full after coding it on the videos. There was the total number of full 3Ws and then the total number of partial 3Ws. That's one of the communication tools we taught. Total number of full SBAR, total number of partial SBAR. So what we're really looking for is how well did they utilize the communication tools that we had educated them on ahead of time, and how many did it completely, and how many sort of started off good, maybe they got interrupted or distracted by something, and they just sort of trailed off before they completed the communication tool. So this was our IU-ISR data, and again, we're scoring them. So on the left side, up to 12, it actually is points out of 30, but since nobody breached 12, we didn't make the thing go up that high because then all the print on this slide would have been way too teensy-weensy. So it's 2, 4, 6, 8, 10, 12 points out of 30. So 30 was the max. So the average total score was 11.2 out of a total of 30 points that they can get on the IU-ISR scale. But we looked really at different, the different constructs that are examined in the IU-ISR: team energy, clear communications, use of team member names, which was something we really harped on them about, is call these people by name, team input at decision points, clinical impressions summarized, patient education on the treatments, reassessment of the patient after the treatments. So the navy was the average total team score, and the yellow were the average score for the teams based on the construct. So what we really tried to do with this is drill it down into, knowing that we have some work to do, since our students are, their average total score is an 11.2 out of 30, that we really needed to be able to identify areas to target where our students were inherently a little bit weaker than the other areas. So this data really gives us something to look into when we plan these events in the future, so that we really know what we need to target on. But if you look at this particular slide, the IU-ISR scores, excuse me, total team scores based on whether they were, all the members were in the face-to-face deliberate practice, that's the yellow bar. All of the members were in a virtual deliberate practice, that's the blue bar. And the mixed was the green bar, so their team had some of each. So we started asking ourselves questions. Did they drop off because they maybe had a weak leader? Did they have to make an adjustment because they didn't really meet people because they were in the virtual deliberate practice session? Was there an issue because the acute care NPs really didn't have a deliberate practice session? What we've discovered with this mountain of data is there's a lot of ways that we can slice it to really kind of get to the root of what we need to work on in the future and how we need to redesign, because we always say, we do these events with all of our students, and we know that there are plenty of areas or opportunities for development or improvement that come out of each one. And anybody who's listening who decides to do one of these events, your data may not look at all like our data, because a lot of it's dependent on whether or not maybe these concepts are being introduced in other classes also, not just by your interprofessional education team. So I think that you can use this data sort of to look for where the decision points are and how to proceed when you plan these events in the future. And this last one is really looking at those ACNP scores, because we really thought they were kind of the red herring and that there may be a whole avenue of research that we can go down in how we train our acute care nurse practitioners so that they can do a good job. So this one we used individual scores, and our nurse practitioner average score was a 15.41. We did have 6 ACNP students, so our N for the nurse practitioner students is small. However, our N is 50. That's the number of times that in total that a nurse practitioner student participated. And again, it leads us to look at the different constructs that are included in the scale: body language, closed loop communication, incorporating feedback, seeking input, identifying critical issues, and patient reassurance. So how well were our teams, and in particular our nurse practitioner students, able to score on those different constructs? What we also found out was that, for reasons that we have yet to explain with our data, but we will because we're going to keep digging into it, is that some of our nurse practitioner students actually got better in their scores as they repeated the simulations, and some actually got worse. And we're very curious as to why that is, so we're poring over some of those student reflections to see if anything kind of hits us from that. And then these were the student reflections that the students all needed to fill out. So we wanted them to all be answering the same questions, but certainly they're dealing with a different depth and breadth of experience based on the discipline that they're currently being trained in. And you also have to remember that the nurse practitioner students are already nurses, and they're in graduate school, so they're already practicing nurses. Whereas our physical therapists, although they're in grad school, some of them have been PTAs, but some have no experience in physical therapy. So the different reflective comments that we were getting provided us with some very rich data, and we showed you some of those examples earlier. Here's a few more. So this was a second-year PT student. Nice to work as a team with other disciplines, try to figure things out. Bigger picture gets more clear. And then the third year, who was actually mentoring the second year, is that he's really going into the interprofessional route more. So he's probably seen this stuff a little bit more than his second-year PT colleague. So he's really bringing in nursing. And now I get more about what they're learning and what the relationship between PT and nursing. So you can see how much more rich the comments are in these students that are a little further along in their program and had a little bit more exposure to interprofessional education. This stuff makes us feel good. This is the kind of stuff that makes us feel good when we see these students who are later in their program really reflecting in a much different way. And then our student reflection, this is a BSN undergraduate second semester student. She thought it was a great growing experience from the interpersonal aspect, treating the cardiac patient, enhancing the skill set, provided with confidence. Excuse me. She said she never used the S-bar or the 3 Ws before, but she said she now could confidently use the S-bar, and the rapid response team, which was part of the SIM, the nurse practitioner was basically the rapid response team, that they promptly made their way to the patient, but she was able to explain what was going on with that patient in a clear and convincing way to get that person to the bedside. And we're hoping, this is the next piece of this puzzle, right? We're hoping that these skills will be able to be translated to the bedside. And how do you measure that then when these students get out into practice? How do you measure the impact that the training that we've given them in IPE really informs their practice when they get out there and are faced with real patient situations? So that really, we've learned so much through the performance of these simulation activities with our students. I think we learn as much or more from them as they learn from us. We know that integration of virtual deliberate practice opportunities during Sim-IPE demonstrates potential to facilitate interprofessional communication and teamwork strategies. These need to be developed in our students. They don't walk in to the program with any of these strategies. We assumed that they knew part of it, and we were that myth was quickly dispelled, that we really needed to teach them in order for them to develop the skill set that they needed going out into practice. We know that the planning for all of this takes way longer than we ever think it's going to. So we have allocated additional time for our planning, making sure that we can assist with the facilitation of these virtual methods of deliberate practice for students and faculty. We have to learn the technology ourselves and then impart that learning to our students before asking them to use a virtual platform for their deliberate practice. We also know that some of the most rich data that we've obtained so far is in the area of video review and qualitative feedback. Not that the student satisfaction stuff isn't important, because we really need to know that what we're doing is viewed as a learning experience by the students, so we still do collect that data. But taking it a step further to really look and see if what they've done and what we've taught them in the deliberate practice activities and in the pre-learning activities has translated into improved performance when we review the videos. Also, the qualitative feedback, again, very powerful. We're starting to do a little bit more research in the area of, did the mentoring relationship really, did it help them in their performance? That's a whole nother line of research that we can use this data for. But we do find that either virtual or face-to-face deliberate practice is definitely valuable in improving IP competencies, leading to improved communication and teamwork. And that was really our goal in doing this. So as far as future directions, we know that we need to continue along this vein of research. It's basically required now of all of our accrediting bodies. So those bodies that accredit physical therapy programs, as well as those bodies that accredit nursing programs, as well as those bodies that accredit hospitals. So some of our listeners, we realize, may be in a patient care setting or a hospital setting where they're trying to really instill interprofessional practices in their providers in the hospital settings. So certainly, with our accreditors really looking to see how we practice together as a team, it's very important in order to ensure effective interpersonal communication, in order to improve patient safety and reduce adverse outcomes. Deliberate practice activities have been added into a lot of Sim-IPE and non-IPE activities here at U of M Flint. Nursing and physical therapy, we do have a community health sim that we're doing now, where the family nurse practitioners do a home care visit via a robot, because our family nurse practitioner students are also distance learners, and so we remote them in through a robot. So we have a whole nother vein and a whole nother grant towards using virtual deliberate practice and telemedicine with this group. We have more communication, teamwork, IP competencies that we're threading throughout the program. So not just in the Sim Center, but also, oh, that's our little timer, also in the classroom, so that we can really get our colleagues here that are teaching maybe these students earlier on in their program to start introducing these concepts. We have a physical therapy, social work, and nursing discharge planning sim, PT and the primary care nurse practitioner handoff, which is being done by a phone simulation. It's like a simulated phone call. That's all we do. Nursing leadership and synthesis, we have a rapid response team simulation. And again, our mountain of data that we need to continue to review from all of our IPE activities so that we can compare structured teams to unstructured teams, and additionally reviewing and comparing our data, which we're still doing using virtual deliberate practice. I have a group right now that did only virtual deliberate practice, and now we're comparing them to a group who did no deliberate practice. So that's sort of another avenue of research where we can see we need to show the power of deliberate practice, but we also need to show that either format is acceptable in order to improve team performance. And that's all we have, but we would be happy to take any questions that you may have.
All right, thank you very much. And we do have a few questions coming in. And I have to say, your timing was impeccable. I heard that timer go off, and I thought, wow, I was impressed.
Boom!
Vicky's asking about, do you have any IPE that includes dental or dental hygiene students?
We do not. So we're on the Flint campus. On the Ann Arbor campus does have dental students. I have participated in Sim-IPE with dental students and nursing students, but it was through the Ann Arbor campus. So here at Flint, we have not yet, I say not yet, done that.
Well, one of the things that we did is we sent two groups of first semester students, one in the traditional BSN program, one in the accelerated BSN program, all went down to Ann Arbor for a tabletop sim experience that did include students from dentistry and pharmacy and the different programs that we do not have here on this campus. So you know where your resources are. You don't only have to include providers from your own schools, campuses, hospitals, wherever it is that you are, but you can also reach out and find those people in other professions that you can integrate with. We have a Michigan State medical school close by that we've also tried to partner with on occasion to try to do some include some additional disciplines into our simulations.
Mm-hmm. Great, thank you. And Liz was asking about veterinary med students, so that the same would be true there, reaching out across different departments.
The same would be true, and if anybody's from Michigan, they understand the great divide between Michigan State and Michigan. But like Dr. Kaiser said, we have done the large-scale poverty sim with Michigan State School of Medicine, which they have a campus right down the street from us. So we're not opposed to partnering with our rivals.
Well, and a similar question along that same line, Will is asking about feedback that you might have about collaboration. She was also asking about dental hygiene students, but you kind of mentioned that sometimes it's difficult or a challenge to work with other groups.
I think we've learned the key is really involving all of the partners in the development of the simulation from the very beginning. I think as we've expanded beyond just the 4 that I initially indicated, we've added other faculty members, and where maybe there's a breakdown as if they weren't included in the development of the objectives and then the development of the simulation. So our best advice is to include everybody on the front end. Everybody should have equal contributions into how the objectives are, because one thing that seems to happen is everybody comes to the table, like I teach undergrad nursing students, so I want them to have X, Y, and Z happen. And Dr. Kaiser teaches the acute care nurse practitioners, and she wants them to learn X, Y, and Z. So we have to blend that together and constantly remind ourselves that we're there to achieve IPE focused objectives. So it's not as important that, of course, I want them to, do hand hygiene and pass the medication correctly, but the main focus is on that teamwork and communication, and that's what's going to drive our objectives. Mm-hmm. So that would be my advice.
Mm-hmm. Sure, thank you. Sarah's asking about if you've tried any asynchronous group activities.
So the virtual platforms that we utilized, we required them to log in synchronously. That did create some challenges for Dr. Kaiser's community group and for the group, the neuro and the cardiac one, just because of student schedules. Like we had this novel idea, let the students identify the time that would work great for them, and that did not work so well.
Then the phone calls started.
They could never identify the time. And so it is something we would think about in the future, but really our project involved those students watching the video and then practicing together. So they really needed to be on the platform at the same time to do that. So we made it synchronous.
Mm-hmm. Okay. Cheryl's wondering about the debriefing and if that was done virtually as well.
So we didn't do debriefing with the deliberate practice groups. We did the debriefing when they came in for their face-to-face interprofessional experience. And so those were all done face-to-face. Mm-hmm. Now, we did do a little bit of debriefing we had family nurse practitioners and physical therapy students do a virtual phone call just to sort of get more comfortable with the SBAR, because a lot of them weren't familiar with it. And so it was first-year physical therapy students and our second semester family nurse practitioner students. So they did their phone call. And then one of the facilitators, which I helped them develop the project, but I did not facilitate it, would go on and would give them some feedback as to how they thought they did in that phone call. And that was done through Blackboard Collaborate, which is a virtual platform. So it can be done virtually. That's not what we did in the project that we described today, but we have used that in other projects.
Mm-hmm. And I would just like to add that they weren't actually doing the simulations the way we utilized the platform. They watched us in the simulation, mm-hmm. either performing badly in the Sims Gone Wild, and then had to discuss what they would have done differently if they had done it. And then they watched us doing that simulation, doing an example of the communication tool. So they had an exemplar that led into them practicing. So they then had to take that same scenario that they watched us do and then do their own SBAR report after they watched us do it. So they weren't really immersed in a true simulation experience the way we did it mm-hmm. in the deliberate practice.
All right, thank you. Amanda's asking about the Indiana University rubric and where she might access that.
So you can, if you do a search on the Indiana or IUISR, you'll see their name, and I'm pretty sure they're on our reference list. Mm-hmm. And you can also reach out to the developers of the tool, which we did, and asked to use it. And they are very interested in other IPE teams utilizing it to generate more or additional support for their team. Like Dr. Kaiser mentioned, the beautiful thing about that tool is it gives a score for the individual, which is the top part, and then a score for the team. So you can really get good information, not just about the overall team, but about individuals on the team, and also maybe look at how an individual can influence the team's performance.
Mm-hmm. Interesting.
If you do look at it, look it up, you will find it in a PDF. If you just want to print a copy, you can look at it. Mm-hmm. It is available as a complete PDF that you can easily print and look at.
Yeah.
Thank you. Well, Norman had a comment also and says, interesting that you noted the scores have decreased. This could be perhaps that the students recognize that they have more to learn regarding IPE and they rated themselves too high. So there might be value in this trend in the data as well. Would you like
mm-hmm.
to comment on that?
I agree. And Dr. Kaiser and I also practice in the acute care center and setting and have done research in that setting as well. And we've also seen those trends where they rate themselves really high on how to use an Impella left ventricular assist device. And then they go to the simulation and then all of a sudden they're rating themselves a lot lower about how they can manage those patients, and agree that it's likely they overestimated their abilities on the front end.
Mm-hmm. Sarah's asking about external evaluators, and did they use a tool, or did they use the same tool?
The video review was done by Dr. York and myself. So both of us have spent the last year coding the videos. We individually coded. There were 56 teams for the fall of 2017. 6 teams were excluded because they had embedded actors that kind of misbehaved
Went rogue.
went off script, so we didn't feel we could score them. But each, Dr. York and I each individually used the coding software to code the videos. We then merged our timelines or our data and then met to discuss each of the 50 videos. So there were no external reviewers. One of the downsides to that is, yes, we were involved in creating the simulations and facilitating, although I did not facilitate all 50 teams, thank goodness. But so because we had 2 of us doing it, though, we felt like that kind of balances it out. And again, each of us did it individually. At one time, we had a 3rd reviewer that was a graduate research assistant, and that didn't pan out very well for us. So we ended up with just the 2 of us.
Okay, well, thank you. A lot of questions coming in. We won't be able to get to all of them, and a lot of folks are saying thank you as well. Last question from Lori is asking specifically, what will you do in the future to expedite the learning curve for use in the virtual platform?
I think that as we attach students to a group, that will give them the opportunity to go in, check out the software, log in, get comfortable with it asynchronously before their synchronous session. I think they just really need to, it's kind of like touching, feeling, moving things around, really having the opportunity to play around with it. And I would like to invite anybody with additional questions that we didn't get to today to please just email them to us. If you go to umflint.edu/nursing, you'll find the faculty page with our email addresses on it. And you can email us anytime, and we'll be happy to provide answers to some of these other questions.
Thank you. And any final thoughts from Dr. Turkelson or Dr. Kaiser?
I think that with interprofessional education, particularly in these health sciences, that don't be naive enough to think that it's just going to be throwing something together and making it work and making sure everybody has that experience. We learned that by accident when we tried our first simulation, which we thought was going to be fantastic. So give yourself adequate time and get everybody around the table. I know Dr. Turkelson already talked about that.
And pilot test,
yes.
Which, like she was saying, thank goodness we did a pilot test before we actually brought the students we were intending to do the simulation with way back with our very first Sim-IPE experience, because that pilot test showed us that not all of the students were, like physical therapy wasn't going to be engaged in that patient care. So we had to make major changes to how we did the simulation to ensure that all of the students were going to be able to meet the objectives we had set out. So the pilot test was key. And then just constantly reminding yourselves, what are the objectives, and that teamwork, communication were our objectives. So we constantly remind ourselves or each other, hey, this is what we're focusing on. We're not worried about the fact that they, maybe didn't do CPR correct 100%. Yes, we're going to talk to them about it, but that, if they were communicating well, then that's, part of the goal as well.
Excellent. Great advice. Well, we've had one request for that email again, or that link that you mentioned.
Oh, it's UM as in University of Michigan. So umflint, FLINT.edu/nursing. And then just go to the faculty page and you'll find us.
Perfect. Thank you. All right. So the thanks are coming in. Nancy saying thank you very much. Willis said great advice. Thank you. Larry said thank you. I look forward to exploring several of the academic resources and tools you have identified. So the thanks are coming in. And with that, I guess I will say also thank you very much for your expertise and sharing your story and your journey with us today. Christopher saying excellent presentation, very interesting and helpful. That comes from Katrina. So with that, I think we'll say thank you and goodbye for today, and we look forward to having you join us again soon.
Thank you.
Thank you.
Bye-bye.
Bye. Who is calling me?